Hi, welcome. Today on Pelvic Power Hour, we're excited to chat with Kelsey Bates, a psychotherapist and founder of Women's CBT. Kelsey will be sharing her experience from her practice serving the greater Washington, D.C. and New York areas, as well as sharing a little bit about her own journey battling with adenomyosis, offering her valuable insights into navigating healthcare, but importantly, the importance of emotional support. Hi, Kelsey, welcome.
Hi, thank you both so much for having me.
Thanks for
We
being
are
here.
so excited for you to be here. So officially, welcome to Pelly Health's Pelvic Power Hour. We're going to dive right in. And we always like to start with, can you share a little bit about yourself and what women's CBT is, particularly considering your own journey with, I'm going to pronounce this right, adenomyosis. You'll
Perfect.
correct me and all of us, and how that personal experience shaped your life and your work.
Absolutely. Well, I always knew I wanted to work with women in some therapeutic capacity. So it was just interesting as I was getting further along in this field is when my journey health-wise really picked up, and I saw firsthand that it was really hard for me to find a therapist who could help me and get it. And I just realized that no wonder it feels like we're underserved there in the therapy space too, because it's so difficult medically to be served properly too. So I just saw so much value in niching and working with women with complex chronic health issues and complex chronic pain. So women's CBT is a lot more than CBT. So I'll share that as we get into it a little bit with my therapeutic approaches. But a little bit about my journey getting here is I was 20 when I first started surgical interventions for pelvic pain, had several diagnoses of peritoneal endometriosis, but my pain persisted. It really worsened as I aged. And my wonderful hero, Dr. Sinervo, I traveled down to Atlanta for his opinion at the CEC. And he finally understood that the culprit of my pain was actually adenomyosis, which is not very well understood or well talked about, but very grateful for him. And alongside that, I got a co-occurring diagnosis of hypermobile Ehlers-Danlos syndrome, which is a rare connective tissue disorder that's genetic, but we're seeing is very highly correlated with pelvic floor dysfunction. So that is kind of my diagnostic journey, but I think it highlights that no matter the pain, source of pelvic pain, it still takes a long time to get the correct answers. I was very privileged getting specialist care, and it still took me that long. I think bringing my personal lens into this therapeutic space allows women to instantly feel a bit more seen and safer. Not all doctors that say go to therapy are saying that in an antagonistic way or a minimizing way, but some are, that quote unquote is just in your head. So I show up and saying, I know it's not in your head. I cannot take your pain away. I'm going to tell you that right now. I can't take my pain away. I can't take your pain away, but I can help you gain coping skills to deal with the bad days in a more effective way. My hope is that those bad days become less intense, that they're shorter in duration, that you can feel like there's hope when your life gets completely derailed, that there's still joy to be found. So my personal and professional opinion is that CBT, any kind of therapy, cannot change physical pain. Maybe in very specific cases, I could be convinced, but with a complex chronic health issue, it's more so, how do I learn to live with this when life has disappointed me, right? Like this is an unexpected outcome for a lot of women. So they have to learn how to maybe rewire some dreams or find different ways of finding that happiness if their path got derailed.
Coping mechanism, really. Yeah.
Yeah. Well, I think this is a good place to ask, what is CBT, right? There's always so many letters in medical soup and psychotherapy soup. So we're going to try to break that down a little bit. And then can you dive into a little bit more of but you're just talking to, what is that benefit to women dealing with pelvic pain? And maybe just explain that a little bit more also for our listeners. And Helen and I, we're leaning all the way in on this one.
Of course. And I like to say I use trauma-informed CBT.
Okay.
So when CBT was first created, cognitive behavior therapy, they would talk about taking irrational thoughts and making them rational, more helpful thoughts. And for a long time, I really pushed against CBT because I felt that was really minimizing. If you've gone through a trauma, if you had massive surgeries due to pain, it's not irrational to be worried about that again. Or if you have a pain flare and you're in the hospital, it's not irrational. I call those stuck points instead. So I draw my language from another alphabet soup, CPT, that's cognitive processing therapy. That was just a form of CBT that the VA developed for PTSD.
Interesting.
And I found that language was so much more beneficial for my clients because they're saying, okay, this is a stuck point. It's not irrational, but it's not helping me. It's keeping me stuck. So how can I reframe it in a way that is still acknowledging that there's pain there and there's anxiety there and maybe there's feelings of depression, grief, and I don't have to necessarily catastrophize. I can have a more helpful way of looking at this. So sometimes I also try to share that with people that are interested in CBT, that if you've had this before and you're not interested, that might be why.
Right. That makes sense.
Very interesting.
And your experience from the women that you're treating and that you see, what are some of the more common emotional challenges that women facing chronic pelvic pain, pelvic floor issues? What are the most common how does it show up emotionally for a lot of these women?
A lot of anxiety about the future, feelings of depression. I'd say intense feelings of isolation at times, like feeling that no one understands, especially, maybe younger women in their teens, college years, early 20s, their friends are on a completely different path at that point. They feel so different and alone. But then, women maybe in their 30s and 40s, they also feel like, okay, if pelvic pain has impacted me having a child or growing my family, I'm going to start feeling pretty isolated from my family and friends too. I think one of the undercurrents that we don't always say out loud, but there's such a grieving process of the life you envisioned and the plan you had. We all have these plans for our lives, and then these diagnoses come in and just derail. So I think a lot of times the work is allowing yourself to grieve. And then with that acceptance piece, if I can accept that this happened, this unthinkable thing happened, then I can start to think of different dreams. And it's not going to be the same. It might not be as good as what you hope for. And there's still joy, right? I think there's ways to find different dreams that are maybe just as exciting in their own way, and acknowledging that you've had a loss, or just the loss of normalcy. Even if it's, dealing with pain every day, that's a huge loss.
Yeah, definitely. And what, so the coping strategies you already sort of started to talk about, and obviously CBT for many, not for everyone, will have a huge benefit to them in terms of learning how to cope when you have a flare up of you're in chronic pain, constantly living with it. But what are some of the things you commonly see that women are most likely to do in terms of self-managing or coping strategies for their pelvic floor or pelvic dysfunction that they're having?
Sure. And, sometimes people come in already with great coping skills. And I find that this population is incredibly resilient, and women in general, they just keep going, which is, good and bad, right? Where that's so much grit, yet we're also wired to continue to feel like we have to push. So it's a double-edged sword. So I want to say that, but I think a lot of people already have great coping, or maybe before they come to me, they're really focused on the physical coping, because obviously that's the first thing that that's what top of mind. And I think now, and thanks to platforms like yours too, we're seeing the emotional and the physical, if they can be treated together, if we can connect the mind body in tandem, that might really be a breakthrough for people that are just focused on the physical piece. And, you know, CBT is part of that, but educating women on their nervous systems and that they can have some power in that and a little semblance of control again in that is so important. I really like to do very basic psychoeducation of what's happening in your brain when you're experiencing a pain flare. You're going into a fight or flight or a freeze. So both of those, three of those responses are common, and your body's not doing anything wrong, right? It's reacting the way it's supposed to a threat. But when your pain is chronic, you become chronically in that state. So to be able to say, okay, this physical things that are happening that you can start to notice. And then instead of saying something very shaming, like what's wrong with me? Like, why can't I motivate myself to go do this because I'm in freeze? Or why can't I just calm down? Instead of shaming, then you say, okay, my nervous system is in that sympathetic state. Here's my toolbox. And this is how I can get that rest state to come. So I love to incorporate somatic work. So that looks, you know, like breath work and yogic breathing and some tapping techniques that help stimulate the vagus nerve. So there's something for everybody. And sometimes people really gravitate to CBT works for me. Somatic work works for me. ACT work, that acceptance and commitment therapy, that's kind of the other prong that I use, that works for me. But I think a beautiful blend of all three of those help you understand your nervous system and have some power in a condition that feels so completely out of control and powerless.
As I say, and as you're saying, like just recognizing that moment that this is, I know what this is, and then you go and grab, as you say, your toolbox, but having to recognize you're in that state in the first place, that's probably takes a lot of work to get there.
Yes, absolutely. It takes a lot of work. And I think I often find too, like when we get into some of the ACT work, the acceptance and commitment therapy, we start to talk about what are the committed actions you take to take care of yourself. And I find that people minimize everything they're doing. Things like taking your meds or eating low inflammation, if that's what your doctor's told you to do, you know, doing your PT exercises, getting a new specialist or another opinion. People just, you know, downplay those things. Those are critical. So lift yourself up that you're doing all of those things. Yes. There's also some compassion that can be found, right? When you are able to stop and say, I'm having a trauma response and I'm not supposed to be able to think rationally right now. I'm asking myself to do something that's not physiologically possible. So if you can say like, this is not all on me, it's not all my fault, because there's so much shame and blame that I see with chronic pain.
Yeah, you know, there's so many things that are popping in my mind as you're talking, but you know, going back to the what's wrong with me, why can't I do this? I think women outside of pain, we do that a lot to ourselves, right? Because we're feel this pressure to constantly perform at such a high level. And I can only imagine that gets compounded when you bring in the chronic pain and the pelvic pain. And obviously our pelvic floor is so critical to our daily lives and peeing and pooping and sexual activity, I mean, everything. So I'm really glad you hit that point hard. Listeners, women, love yourself, listen. But what do I want to say? Like, push yourself up. But I think it's so important to just reframe how we talk to ourselves, even on a daily basis, right? Like, wake up and say something great to yourself instead of all the things that I'm not going to do today. I'm thinking about that from my own head right now.
You're absolutely right. And I work with a lot of kind of my other part of my niche is like very high achieving women that this might be the first time they're trying to ask for help or needing to rely on other people, or maybe they have to have some accommodations with work. Like these are all very new things. And again, that grit and resiliency, that's a wonderful thing that's pushed them here.
Yeah.
And we need to also know when it's okay to dial it back and ask for help and slow
Asking
it
for help
down
is
because
hard.
there again a lot of shame around that.
Asking for help. The other thing that I really am glad you touched on, Kelsey, is the seeking a second opinion. A lot of times, especially women, Helen and I have come across in different aspects of pelvic health is, well, this is what I was told, and something maybe doesn't sit right with you 100% in your gut, but you just keep going that path because it's hard. And you can probably speak more to it from the pain perspective, but it's hard to be persistent all the time and to constantly advocate for yourself, especially when we know there is medical gaslighting, and that can be really frustrating. I've had that happen to me, and I'm like, oh, feeling deflated walking out of the office, but it's hard to pick yourself back up. So how do you work with patients in that scenario where you're like, maybe a second opinion is not a bad idea?
Yes, that and medical gaslighting, there are so many doctors that will create reasons for women to stay away from second opinions. And so I try to say there are also so many doctors that are ready to help. And there are good therapists, there are bad therapists, right? You can keep, it's not your issue, like that they had this reaction. And that's when I say, like, the doctors that you do trust, do they have referrals? Because you're going to be able to have that kind of layer of trust already. There's also medical burnout. And so sometimes clients need to take a break, or women just dealing with this of like, it's okay also to say, if it's, and again, this is not for emergent medical issues, but if they want that second opinion and they say, I need a month before I think about it, take a break, because it's important for your mental health because it becomes another job. Sometimes a part-time job, a full-time job, kind of depending what you're dealing with. And it's okay to take a break.
So staying in the same line, your approach emphasizes creating a supportive team to navigate, chronic health issues, pelvic health issues. Can you elaborate on why that's really important for you as a psychotherapist and the therapy that you do?
Yes, I think my own personal experience probably also informed this, but I found that I finally found stability. And I won't say, symptom free, but I will say, stability when I had that A team of well-rounded practitioners. And if you also have practitioners that are willing to collaborate and take that mental load off you and, sign the release of information, have them, have your acupuncturist and your medical masseuse talk, what are you seeing? What am I seeing? Have your, OB and your surgeon be, advocating for you. I think it becomes better care for you. It becomes less mental load for you to carry and less things for you to try to remember to bring up at each appointment, and more advocacy for you. So that's something that I find very important. If people that work with me are willing and want that, I want to be in touch with your medical team. I want to tell them what we're doing. I want to ask them if they have any thoughts that they've, I welcome feedback from different, especially like physical therapists. I mean, they're amazing.
Amazing.
And it's also, pelvic PT in particular is a very intimate, emotional endeavor, right? And I think working tightly with them can also help the emotional progress within the physical therapy too. I see it both as a provider and personally that it makes a difference. And I would say, especially doctors that are really passionate about this space, they want to do that for you. They want to help.
Can I ask you, while we're on this question, because you were able to create that, it sounds like, for yourself.
Yeah.
Can you talk a little bit about how you did that, or how you advocated to get your, I mean, obviously as a practitioner, you're coordinating, but how did you advocate as the patient to push for that?
Yes, that's a great question. I think definitely the doctors that I trusted the most, like my physiatrist for pelvic pain, they helped. Who is my surgeon going to be? Because I trust you. So what name can you give me? That's how I found Dr. Sinervo.
Okay.
And then being able to ask really the doctors that I really trusted. I said, okay, I need a PT, I need a nutritionist, I need medical massage, I need OT. Like, it was a combination of getting referrals from the doctors I really felt got it, and doing my own research. Google is helpful when looking for, people in your area. But there's also great platforms like Nancy's Nook. If you're looking for more endo-related referrals, that's kind of a vetted platform. Platforms like this, the Ehlers-Danlos Society has a list of providers within the states. So I often recommend, going to the society of whatever kind of chronic health. Oh, Vestibulodynia has their own society. Tight-Lipped is a good podcast that I believe has some recommendations. So that's how I pieced it together. So platforms like this are so important because it's not easy. It's not easy. And you also kiss a lot of frogs, and you do go to appointments that don't go well. And then you say, okay. And that's when I said, okay, I'm going to give myself that break that I tell other people to take, and I'll try again. Also, allowing yourself to be disappointed when you have like an appointment maybe you were excited about and it didn't go the way you wanted it to. That's very valid to have a disappointing feeling.
Yeah. So on that note, how do you prevent yourself from, or what would your recommendation be for the disappointing appointment, and not going so far to be like the end of the world, like there's no help out there? Because I imagine it, it teeters. I know when I was going through a really severe pelvic pain, and there were some points where I was like, man, I'm not sure there's a way through this, and that's hard.
Yes. I think acknowledging that that's hard, because maybe other people that are not navigating chronic pain or chronic issues on a daily basis probably don't understand the disappointment of a bad doctor's appointment. So they, that is something that might feel more unique to this when that becomes a very regular part of your week. I would say if you can use some of those CBT tools, or there's actually a wonderful workbook made by therapists that's a CBT journal that teaches you how to do that at home. I believe it's called Journal for Anxiety. That might not be right, but there is it's made by therapists. So you could pull that out and write down the evidence and challenge that, catastrophizing feeling. Like, it feels awful. It feels like the end of the world. Rationally, I know it's not, but it still sucks. And I can allow myself to really.
It still sucks.
Yeah. So I think, there's a difference also between reframes and mantras, because some people just try to swing from it's the end of the world to everything's great. And neither of those lend itself to a very helpful frame of mind. So that reframing is that it's dialectical. It's that two opposites are coexisting, that this is painful and hard, and there's still options, that they don't have to cancel each other out.
I like the difference between, what was it, mantras and what was the other thing?
I would say that toxic negativity versus toxic positivity, right? The catastrophizing.
Yes, extremes.
Yes.
Yeah. I'm probably guilty of doing this extreme sometimes.
And we all are. And that's what I try and normalize too. I think we have something like 6,000 thoughts a day, and we cannot expect them all to be very helpful. So invite that compassion too.
Yeah, that's a dose of reality. 6,000 thoughts a day. Did you know that, Ellen? That's a fun fact.
No.
No.
I didn't.
So we touched on this a little bit, but just to take it a little bit further, a lot of women might be feeling a sense of loss to their identity. You touched on this in your intro, or having an identity crisis as they're coping or trying to cope with chronic pain, especially pelvic pain that could be eroding, their relationships with their friends, but also with their partner, all kinds of things, and start to unravel. So what are some ways that therapy can kind of help them reclaim? And I know you've touched on some as we go through, but just bring back a sense of empowerment instead of like my whole world is falling apart.
Yeah, that grief, that feeling like my whole identity is now wiped out or irrelevant. Maybe that identity was a spouse, a wife, and a high-powered career woman, or maybe the identity was wanting to be a mom and you have fertility issues. Those things are devastating. And the thing I find most helpful when we're processing the grief is talking about this reality gap. And Stephen Hayes created this with the acceptance and commitment therapy. He says, the larger the gap between what you want and what you wanted and what you have, the larger the gap, the bigger the pain. And so sometimes in part of the grieving process, there's, the stages of grief. There's denial, or you get stuck in anger or depression, and you want to find a way to get back to that acceptance. So I think honoring those dreams that you had or that identity that you had is important. And does it have to be an all or nothing thing, right? That I have to work this way or I'm a failure, right? Or could we start to make this more flexible? Can we have some accommodations with your work and still encourage you to have that identity? And it looks different, but we can maybe start to close that gap a little bit. And accommodations with the kind of friend you wanted to be. I think one thing with the pandemic showed us is we can do a lot of connection virtually too. If in person, going and traveling and taking trips is how you want to spend time with your friends, but it's not accessible right now, does that mean forever? It doesn't have to. But for now, can you ask them to meet you where you are? So I think we can make some accommodations within the identity space. It doesn't mean you have to lose everything. But that's another one of those, unhelpful thought patterns. It's very all or nothing. We really wanted it to be a certain way. And if it can't be that way, we feel like it's over. And in some cases, if there's finality, we have to grieve that too. When people are ready, and we can't take them faster than they're ready to go. But when people are ready to acknowledge the grief and the loss, that creates, I think, space to reclaim some different identity or a hybrid version of maybe what they wanted and what they have.
Like a variation of what you thought it would be. It might just come in a different form or a different way, and having that acceptance is difficult, very difficult. But I think of what you're saying is once you accept it, then you can move a path forward, but you really got to get there first, I guess.
And acceptance, I think sometimes too, people get tripped up that means I'm giving up and I'm not going to keep trying treatment, or this is just how it is. And that's why we got to pair my body and my mind are here. I accept that's where it is. And these are all the committed actions that I'm taking. That doesn't mean this is forever. And we can't accept the unknown because it hasn't happened yet. So acceptance becomes more of like, can I just see like a week at a time or an hour at a time if it's a hard day? And acceptance too it's not like some switch that becomes flipped. I think that's also like a myth. I feel like that people think there's something wrong with them because they still have unpleasant feelings. And, no, that's part of being human. You've got to experience it all. So acceptance is a daily thing. And that's when I sometimes do share that for me, some days I can't get there. But that happens less than it used to, right? But
Yeah.
this is not a switch that was flipped and I never have any unpleasant emotions. And that's normal that you have unpleasant feelings. It's normal to have days where you're just back in that anger or depression. That doesn't mean you aren't doing the work.
Or that you haven't made progress, right?
Yes.
Yeah.
And if, I mean, you spoke earlier, Kelsey, that, you know, when you were going through, you had to pull together your own team, and it was a great support to you. But as we've said before, and the reason for what we're doing with Health, it's not always easy for people to find that information. Don't know where to go, don't know where to start, or even if they have the time or inclination to be able to, you know, to invest in researching all of that. So if for a woman out there who's listening to this, maybe on that journey of starting to seek support and wanting to know, but what do I do first? Where do I go? And how do I sort of describe what I'm feeling or my symptoms? What advice would you give to someone on just starting that journey?
That's a great question. I think, you know, being able to define your pain, especially pelvic pain, can feel very like a second language. It's you're not, you know, familiar with all these terms. So I think when I think back of some of those resources like Nancy's Nook or Institute for Pelvic Health, any of these societies, I think if you have a inkling maybe of which one of these sites might be a good one to try, to look at, maybe you can start to just look at the symptomology, like, is it burning what I'm feeling? Is tingling? Is sharp stabbing pain? You know, because it is so difficult. And it's also, I think, still very uncomfortable for people to talk about. You know, being able to be open with your partner or your doctor that you have pain with sex, you know, these are things that if the more that things become destigmatized, the easier it will be for women to find those answers. But
100%.
I do think, you know, platforms like yourselves and things like the IndoCo, you know, other places that you can go to maybe read other people's experiences in a moderated, safe platform way. Also, you know, maybe even on those platforms saying, where should I start? You know, maybe asking those online friends for ideas is not a bad thing. And if you're looking for therapy to also help, platforms like Psychology Today or Zen Care really allow you to filter, like, I'm looking for someone with women's issues, chronic pain, and filter by your state, by insurance if you need to use that. So there are these platforms that can try to make it a little bit easier. And then, you know, maybe even your PCP or pelvic, you know, PCP or OB can recommend pelvic PT, and they're always so well connected that it feels like that's a good place to start, but it is also very overwhelming.
Yeah.
What are your, kind of switching gears a little bit, what are your thoughts on the effectiveness of online therapy, online group therapy for women, especially when they're going through chronic pain? Just going back to something we touched on earlier, it can feel very isolating perhaps. And so what's your view on that?
Yeah, this is a great question. Before the pandemic, I would have never envisioned that I would be working at home. So that was something that dramatically changed. There were very few people that offered mental health service. I am actually fully telehealth still, because I actually find that it breaks down the barrier for people with chronic pain to incorporate therapy.
That's
because
true.
in my opinion, I don't need to touch you, right? I don't need to examine you.
Right,
I don't need to do, you know, visceral manipulation like a PT does. Save that energy. And because it's taxing, save that commute and that taxing energy for an appointment you've got to go to. And I find that actually it's been much easier for people to be in therapy in that way. People are looking for community. So running groups is one of my favorite things to do. And, you know, given that my groups are in DC and New York is where I'm licensed, we couldn't do that in person, you know, but we get to have this online community of multiple locations. But it's nice. You can find people that live nearby, within that too, that you could take that friendship offline. I was worried. I was skeptical that it wouldn't feel the same, that it wouldn't feel as impactful as being in the room. And I think other therapists probably still think that. For my population, I think it works so well. And I think it makes it more accessible. If you're in a flare, but you still want to be at group because you want people to encourage you, do it from bed and with your heating pad. So in that way, I think it's important. And again, a lesson from the pandemic, we can't minimize the importance of being together in person. But I think overall, if you are not able to be in therapy because it's one more appointment that your body can't make it to, it's more important to be in therapy. And the research shows that the telehealth outcomes were not any different. Sometimes we're actually more effective. It's also an insight into, are you sure you're doing okay? Because I can see your space.
Yeah.
I get different data, right? And
That's interesting.
are you feeling okay? Are you feeling more depressed? Are you feeling more anxious? I can kind of get a different sense of that too. Telehealth also allows people to feel a bit more at ease because they feel safe in their own house.
Yeah, that's true.
So sometimes that rapport comes a bit easier too.
And do you find in the group dynamic that you're like the other women are supporting other women when they need to be lifted up? And I mean, it's got to be fascinating and really motivating, I would imagine.
Yes, groups are, again, one of my favorite things to do. The thing I make very clear to is like, this is a therapist-led group. So my job is to keep the group safe. So we don't give medical advice. If someone says, hey, I need a referral, that's another great network. But we don't give medical advice. And part of the way I structure my group is it's part psychoeducation and tools, and then part support. So my hope is you walk away with more than you came in with. Sometimes, a non-moderated just support group has the potential to be a little less helpful, or it might leave feeling like really scared and nervous because you heard a story that scared you and there wasn't somebody to step in, right? So I'm proud to say my job is to keep this place positive, not toxically positive, but we are here to feel empowered. We are here to help each other. And it's beautiful. It's beautiful to watch people say, no one has ever understood me, but you said exactly what I was thinking. And that might be the only space they have that. It's a privilege, absolutely, to do that.
What important work you do to create those spaces, to hold the space, to be able to guide people through pain to empowerment. You're just doing phenomenal work. So thank you for doing that.
Yeah.
And
thank you.
Can you share some insights from your, experiences from your practice that highlight the importance of education in that process of empowerment to help them manage their daily lives and manage their pain? Obviously, there's the therapy side, but what role do you see education playing?
Absolutely. I mean, like we talked about that psychoeducation of the nervous system, that's like that therapeutic side that feels, okay, I can maybe regain some sense of control in this situation. I use an exercise called the circle of control, where either you can draw a circle on a piece of paper and literally, write it out, or you can do this more imaginatively and imagine yourself sitting on a circular rug. And all the things, all those committed actions you're putting in that circle. What's outside of the circle is the outcome. So you can do all of these things and not know the outcome of what's going to happen. You can't control the outcome, good or bad. That can take some shame off of this didn't work, right? It's not for lack of trying at all. This is not your fault. This is not a fault of your own making. So like that psychoeducation piece, I think, dismantles some shame. But when you talk about that physical psychoeducation and medical psychoeducation, that creates knowledge and power. And when you have the correct diagnostic information, you can get the right treatments. You can actually plugged into the right community. You can feel less alone with that. Having depending on, various diagnostic experiences, there are lots of societies out there geared just for that. So you can feel like I have a space again. Because you might have felt like you lost your community, or a lot of people in that journey. And okay, now I have a community again. So I think it's so important for your physical body to get the right care, but also to feel like I can be in a community again and people get it.
Well, I think the everything you've shared, Kelsey. I mean, I just want to join your group anyway. Sounds amazing. I'm like going, oh wow, well, yeah. But no, it is important, and everything we've spoken about. It's just, I think we're all human at the end of the day, and it's to make you feel a little less alone. We're all having different experiences, and how we process that experience is different for everyone. So I think having those spaces and the services like you offer are incredibly important. And I think anyone listening to this will feel probably empowered or a bit more enlightened as to what they could go and look out for, and in an area near them, perhaps. And so thank you very much for sharing everything that you have done with us today. If anyone who is in that vicinity wants to know more about women's CBT, where can they go? Presumably your website.
Yes, womencbt.com. Very easy to remember. I would be happy to provide phone consults. I do that for free if people are interested in group or individual in the New York or DC area.
Wonderful. And we will include many of the things you mentioned in the show notes for resources. There was so much information. Thank you for your time today.
Thank you both so much. This is such an important platform, and I'm excited to be a part of it. Thank you for having me.